Hi there. If you have been diagnosed with a tendinitis or a tendinopathy or a bursitis and have quickly been typing away on Google to find out what it is, and you still might be a little bit confused, well, then stick around, because today we're going to chat about all of those things. We're going to chat about what they are, how you might get them. So it's really just a bit of an explanation that we've got for you today, hopefully to give you a little bit of clarity. So I'm Dr. Lisa. This is Dr. Britt.
Hi guys.
And we're chiropractors at Errol Street Chiropractic in North Melbourne. And over the last couple of months, so June and July, we've really been chatting to you guys about some of the questions that we often get asked in the office. And this is a big one because we see a lot of sports people, and obviously we work on primarily spines, but we are trained to check all the other joints as well. So tendinitis, tendinopathy and bursitis. So tendinitis, so what is a tendon to start with? So what is a tendon, Britt?
So our tendon is what connects muscle to bone. So it's that kind of narrowing of the muscle that attaches into that area of our limbs or our spine.
Yeah, so it's definitely a connective tissue. It's very thick and fibrous, so it does a big job. So tendinitis, when you hear itis at the end of any word, so spondylitis, tendinitis, itis, what that means is inflammation.
Yeah.
Okay, so that makes sense. So tendinitis is inflammation of the tendon.
Yeah.
All right. So how do we get this tendinitis? So we can get it through things like overuse,
playing tennis,
sports, repetitive work, repetitive hobbies. They're the things where we put in extra load and strain and overuse. Even using things like vibrational equipment that can create even tendinitis from working at the computer.
Repetitive movements.
So it could be even from sitting at the desk.
Yeah.
You know, that we might get a bit of that around the wrists or elbows even and shoulders.
An injury can cause a tendinitis as well.
Totally. A sudden injury can stretch and create that
inflammation.
So tendinitis, inflammation of the tendon.
Yeah.
Tendinopathy. So tendinopathy, well, let's just take a step back. What are the symptoms of tendinitis? So for those of you who've suffered from it, you know it is a bit of swelling, a bit of redness and pain on that movement.
Yeah.
Okay, so it is kind of hard. All of these things really have a similar set of symptoms.
Yeah,
the tendinitis, tendinopathy and bursitis. So it tends to be diagnosed more through location, but also through diagnostics with having an ultrasound. Or maybe even MRI, depends on how complicated it gets. So they've all got very similar symptoms. So tendinopathy is obviously tendon related because there's tendon in the word, and I kind of tell patients here the opathy, the path, there's the word path in there. So path, I say, is pathology. There is there's damage. Okay, so now there's some damage to the fibres in the tendons. All right. So tendinopathy tends to be more when your tendinitis doesn't resolve.
It becomes a more chronic issue.
So you get constant re-aggravations, and that is through, it could be through continuing to do the activity and not getting proper care.
Not dealing with your tendinitis when it's present. Absolutely.
Definitely. So, yes, and obviously not getting proper resolution for whatever reason can lead to tendinopathy. And that then can lead to, if that's not resolved, that can lead to things like, severe damage to the tendon, can lead to tearing.
Can actually cause some nerve damage around the area as well if the tendon is quite damaged.
Absolutely. So tendinopathy can be a bit more serious, and it's more from repetitive injury and non-resolution of that tendinitis.
A lot more of a chronic issue when it comes to tendinopathy.
It's chronic. So we see a lot of like tendinopathy with tennis elbow.
Yeah.
It's a big one.
Yeah.
And there's a lot of them are misdiagnosed. So
We see a lot of tennis elbow.
yes.
Yeah.
And tennis elbow really a lot of time is more chronic, and people call it a tendonitis, but it is in fact a tendinopathy.
Yeah.
Now the third one is your bursitis.
Yes.
Now bursa. So I'm Italian, so for me it's easy to remember. Bursa means bag in Italian. So
there you go.
yeah, in Latin it's a sack.
Yeah.
All right. Now we have bursa. These are normal things, just like your tendons are normal, your bursa are normal, and they're very clever little sacks of fluid that are in between tendons and bones, and in between, tendons, different tendons.
They stop those tendons and bones from wearing on each other.
Yeah, so it's a little sack, little fluid-filled sack to a bit of cushioning and to help that friction, so it helps to minimise. However, if we irritate those joints, then that can really cause that inflammation of the bursa, and then voila, we have bursitis.
Yes.
Now, there are certain areas that, we see these all over the different tendonitis, tendinopathy in all the joints. So shoulders and elbows and wrists and knees and ankles. But bursitis, we tend to see quite a bit around the elbow.
Yes.
Okay, so from leaning on the elbow.
Yeah. Tends to coincide a lot with a tendinopathy. So when an issue's been quite chronic for a while, that's when the bursa can, as a flow-on effect, become quite inflamed. You can have bursitis on its own.
Yes.
But it is quite common to have bursitis coinciding with a tendinopathy.
Yeah, because also different sort of occupations can suffer with these different conditions, and especially that bursitis around the knee.
Yeah.
So if someone is laying carpets or they're concreting, they're doing a lot of kneeling, then there's a few bursa around the knee, there's one on the top, and there's about 4 around the knee. So depending on where you're putting that pressure.
I was going to say shoulders another common one as well with the bursitis.
Yes.
We see a lot in practice.
Yes, we have that subacromial bursitis in through there. So, all right, folks. Well, thanks, Britt.
Thanks, Lisa.
She'll get back to tennis.
Yes,
now.
I will. I've been enjoying playing with this. I'm going to buy a racket.
I had to pull her away. She wouldn't come and do the video. All right, everyone. We'll see you all next time. Have a great day. Thanks for watching.